Hello viewers, in today's session by KAPDENT, I will be teaching you how to assess hand and wrist radiographs. So now you might question what exactly is the purpose of these radiographs. So first of all, let me tell you, we as orthodontists deal with growing as well as non-growing patients. So it becomes important to estimate the skeletal age whether by hand and wrist radiographs or assessing the cervical vertebra maturation because it helps in ascertaining the growth spurt and the amount of growth available, which in turn further aids in the selection of an appropriate appliance, the course of treatment and retention after the active orthodontic therapy. So without further ado, let's dive into the hand and wrist radiographs, which is made easy for you. So I would explain the basis of the assessment and the stages so that you never get perplexed about the same. Let's get some terminologies clear. A long bone very simply is divided into three segments. So first is epiphysis, which is the head of the long bone. Second is the diaphysis or the shaft. And third is the metaphysis, which joins both these segments and contains the growth plate. Another terminologies which you must know are the proximal and distal segments. So anatomically, proximal is something that is nearer to the trunk or the center of the body, while distal is something which is farther from the center of the body or trunk. So I got this very beautiful illustration. As you can see, when you look at your hand, your wrist is something that is proximal, that is closer to the center, while your hand and fingers are distal, that is something away from the center. So these are the 5 words which you will be hearing time and again during the course of this video. The method which I shall be discussing today is given by Bjork, Grave and Brown. In every hand and wrist radiograph, you will be able to make out the distal end of long bones of the forearm, that is radius and ulna, the carpal or the wrist bones, the metacarpals and the phalanges. In the given illustration, the highlighted points denote the growth sites. So the digits are numbered from 1 to 5, 1 being the thumb, second the index finger, third being the middle finger, fourth being the ring finger and fifth is the little finger. Apart from this, there are also some abbreviations used. For example, S stands for sesamoid bone, PP for proximal phalange, MP for middle phalange and DP for distal phalange. Now this slide is very important for you to understand. So this shows the sequence of the ossification as it progresses. So first is when the width of epiphysis becomes equal to the width of diaphysis. Second is the ossification of a small calcified bone at the thumb called the sesamoid. Third is the capping stage and fourth and final is the fusion stage. Now you need to memorize these 4 stages, maybe with the mnemonic or something. If you have understood the sequence of the ossification progress in the previous slide, now I present to you the 8 stages according to Bjork, Grave and Brown's method. So the 4 stages are WOCF, which I presented to you in form of a mnemonic or a short form, and adjacent to it given are the growth sites. Now that is something which you will have to learn and mug up, and I'm sorry, I really sympathize with you on this, but this is as easy as it gets. So now you may take a screenshot of this chart as well. So first is the widening of epiphysis such that it becomes equal to the diaphysis. So we look for that in 2 sites, that is PP2 and MP3. PP2 is the proximal phalange of the second finger. MP3 is the middle phalange of the third finger. So O is simple, it is the ossification of the small calcified bone, that is sesamoid, adjacent to the thumb. Third stage is also, it has only one site, MP3. It is the capping of the epiphysis over the diaphysis. Now fourth is the fusion. 4 for fusion and 4 growth sites, F and F. So the 4th sites are DP3, the distal phalange of the third finger, PP3, proximal phalange of the third finger, MP3, medial phalange of the third finger, and finally the radius. Now the highlighted blue square, that is on O and C, signify the highest growth spurt that is present. At this point or even suddenly, if you are handed over a radiograph, I do not expect you to recollect all the 8 stages because it is difficult. So now here is a flow chart which is very systematic, and you may even take a screenshot of this which you can follow to identify or assess the skeletal age. So first and foremost step is to identify the ossification of the sesamoid bone, if it is present or not. If it is absent, then you look for the widening, that is widening in PP2 followed by widening in MP3. If the ossification in sesamoid bone is present and it is visible, then you look for the fusion in DP3 and you progress as follows. If DP3 fusion is absent, you see for capping in MP3, and if fusion in DP3 was present, then you move in the following sequence, that is you look for fusion in PP3 followed by MP3 and finally radius. Okay, so it's now time to put this newly acquired knowledge to test. So first of all, now you may pause the video and see if you can make out the stage. Okay, so let's see. First we look for the ossification in the sesamoid bone, which is absent in this case. Therefore, we now progress to see if there is widening of the epiphysis equal to the diaphysis in PP2, that is proximal phalange of the second finger. So in this case, it is present. Yes. Now we progress to the another stage, that is MP3. So we can see in this also the epiphysis is equal to the diaphysis. Therefore, this patient is in stage 3 of. I really hope I made the topic easy for you. For any queries or suggestion, you can leave a comment below.